Got a number of concerns at St Vincent's Hospital about these proposed changes. I mean, the first one that's probably one of the biggest is that there's no evidence actually that drug testing like this will actually increase jobs or help people with substance use disorders back into the workforce. And these measures have been developed with no clinical input from our sector, from doctors who are working in the area, and nurses and other health providers. So we're very concerned that there's no evidence that this will work. The government's independent Australian National Council on Drugs back in 2013 reviewed all the evidence and said there is no evidence that that this kind of testing will help people into treatment. So we're looking at a situation that's been developed without any evidence that it will work for what it's supposed to do. The other concern we have is that it's very expensive. The government hasn't released how much it will cost, but when we look to other experiences, for example in New Zealand, back in 2015, they spent around $1 million on testing just over 8,000 people, and only 22 people tested positive. We need to argue whether this is a good use of public funds. What we're concerned about with the way that this kind of program has been designed is that it isn't there to actually help people that have substance use disorders into treatment. What it will do more likely is actually increase stigma and prevent people from seeking treatment. We know that stigma is one of the biggest barriers to encouraging people to treatment, and that will have far-reaching effects even beyond the trial sites, in the sense that people will be reluctant to come forward for treatment, and we're already seeing that in the community. So our concern is that if this is a genuine attempt to help people into treatment who might benefit from it, there are many, many other more cost-effective ways of helping people into treatment. One of the big concerns is that what proportion of those 5,000 people who are randomly tested will actually have a substance use disorder. We need to have expert assessment to decide which of those tests that is positive is actually linked to a substance use disorder. And remember, there's only 3 drugs. So what about the most common drug we have a problem with in our society, and that's alcohol? That's not going to be picked up. So we really misconstrued. If we're actually trying to help people, punishing them is not the way to go forward.
Nadine Ezard there.